Assalamu alaikum. This is an excellent case. We're going to do altered cast technique, okay? And we're doing border molding around. So just as a quick look, okay, I would tell you there is some good border molding here in the interior, but posteriorly it's not. How did I judge it? Do you see the roll of tissue in a sulcus? This is how it looks like. What happened here? There's a beautiful roll here. What happened here? It's thin. So this might have not been introduced into the lingual pouch correctly. Because if it was correct, it should have the same roll of thick material. Because remember, border molding, we're recording depth and width. Okay? So if it's not wide, and the lingual pouch is like a pouch, so it has some width in it. So that means that you have to record this better. And what might be encroaching on it, many times, it's either there is an undercut, okay? There is a bony undercut, and the tongue is close. So it comes like a tongue trap, but a posterior tongue trap, okay? It doesn't allow you. So make the material thicker, longer a bit, move the tongue away with a mirror. So remove the tongue with a mirror and then insert it in those sulcus, okay? Looking at the other side, all of the lingual is suffering from this thin margin, okay? See how thin it is? Yeah. Okay, let me just put it between two fingers, it will be more obvious. Okay, see how thin it is? So this did not record the depth. It might have recorded the depth, but not the width. So I need it to be wide to record the sulcus. Because I want the depth in this area and the width here. It will become a trapping point for the denture downwards, because the tongue, when it's thick, it's not thick here, okay? It's not thick here interfering with the tongue. It's thick on the border, very low border. So it will be like a seating advantage for our sulcus, because we can get the concave surface where the tongue seats in this concavity, seating the denture even further. So it's aiding in the retention. Yes, so it is the thickness, which I'm concerned about on this side, all of this. Here it's only posterior. So retract the tongue. The tongue seems active. You see the indentation of the tongue here. Okay? So this is my comment. The side, buccally, both are good. Now what I'm going to do we take a question that might arise? Do we cover the retromolar pad with our border molding? Yes. Always in impressions we record fully the retromolar pad. We cut on the denture material, not the cast. The cast should be beyond the retromolar pad. So even if this is long on the retromolar pad, it's okay with me. Here I'm concerned with this. I'm going to do border molding inside the patient's mouth. Here for the length, I'm going to insert my finger inside the patient's mouth and measure it. Okay? So I'm going to do it now. Can you just hold the camera, please? Stay here. I'm going to record it. This is how much my finger entered. Did I get the same? This is how much my functional position with the tongue anteriorly. This is short. See? So you need even more length. This is how much my finger entered in her lingual pouch. Okay? When I came back here, comparing, there are like 4 millimeters missing. Once more, all of these problems occur because of the distal tongue encroachment on the space, on the lingual pouch. It's wide. The tongue, especially in patients that have been edentulous for a long time, the tongue in the back takes its width. It expands. So you're going to reconstruct and relocate the tongue in its original place, because we're replacing teeth. So posteriorly is more problematic. So you measure it with your finger, see how much is the deficiency, fill it in with material, make it thick, remove the tongue away, displace the tongue with a mirror, and then place it. Do each one separately.